And so we also wanted to see how many people were working in as frontline workers or essential workers. So 34% indicated that they were working in the public health field, medical field, and academia. So looking at how the coronavirus and civic unrest have impacted our community, 30% or 51 of 169 people indicated that they have experienced xenophobia or racism related to coronavirus and pandemic. To further understand how our community is feeling, I'd like to share a few quotes directed from our participants. I feel belittled as if I'm a rodent spreading disease. I feel attacked and unsafe in this world, but I try to not let it affect me. I'm afraid and insecure. I don't want to be in public because I'm afraid for my safety. I felt as if the pandemic was my fault. It's unfair that an entire race be stereotyped based on false information. Sometimes when I'm in public, I feel as if people are staring at me oddly because I'm Asian. It felt very wrong knowing that we are all the same people, just the color of our skin is different, but others don't see it that way. Scared, nervous, and anxious. I have since limited my exposure to the public, not because of COVID-19, but because of my physical safety from others. So these were just some of the responses that we got from our participants on how they're currently feeling during that time. So coronavirus and health. The coronavirus has impacted our physical, social, mental, and emotional health negatively. So so the blue, the red, and the green colors, adding all of that up, the percentage would add up to more than 50% who indicated that they said that coronavirus have impacted their health in these areas negatively. And we also asked them how it's currently affecting them, and some of them said tiring, exhausting Zoom meetings all day, isolation from family and friends dying from COVID and grieving them virtually. I already have chronic anxiety and depression. The sheltering in place mirrored depressive habits. Also, I gained weight and I'm not exercising. Not being able to hug my family has been hard. I recently lost a large number of family members in a tragic fire. So going into 2020 was hard, and then the pandemic really had me depressed. A lot of my plans have been put on hold, and I'm dealing with a lot of anxiety regarding the uncertainty of my plans. Isolation, depression, anxiety. And here are some other ones that I also want to highlight. My roommate moved out, so I've had to endure quarantine alone in my apartment, which has been really detrimental to my emotional, mental, and social health. This has gotten in the way of my schoolwork and teaching job. I feel suffocated because I can't move around. I'm always at home and I always stare at my computer to get work done or to relax. I miss hanging out with friends and I miss being in class. As a small business owner, the coronavirus pandemic has caused significant mental and emotional stress for myself and my family in trying our best to make ends meet financially while only operating our business virtually, but with limited capacity. Being at home and worrying about deadlines and schoolwork and internship and other commitments all virtually has made me depressed and unmotivated to even have a conversation with a friend. So to me, this is pretty alarming to hear how people are feeling, but also in a way kind of comforting because I feel that I'm not alone. The other people are feeling this way as well. And as you can see, we have people who own businesses. And during this time of the civic unrest, they had to close down their businesses. So what was happening was really impacting them financially. And as someone who's also going to school, I really sympathize for people, like all of us, who have to be on school all day. Our jobs are on Zoom, and the way we interact with our friends are also virtually. So it's impacting our physical health, our mental health, our social health, and all the aspects of health. Although we've there are some negative impacts of the coronavirus, there are also positives that came of it. And some people said that I get to spend more time with my children, which is an improvement, as well as I don't have a daily long commute, which is also nice. However, it has been tough sheltering in place, managing two young children, and trying to work full time is not easy. I feel as though being quarantined has made me more organized. Prior to the pandemic, I was very flustered due to all my obligations, but because of quarantine, I had no choice but to stay home. So I was able to focus more on school. I was able to distance myself from a lot of other things, which I feel gave me a clearer perspective of them. I was also able to spend more time with family due to quarantine. It has impacted me because it made me realize to be more grateful in my life. I am making more out of my life and trying to invest in myself and the people around me. So people are saying that they like being at home because they get to spend more time with their family members, as opposed to being, going outside and working all day. So some people, the coronavirus stay at home lockdown has positively impacted their health. Um, So coronavirus and mental health, um, we've asked our participants if they know someone who tested positive for COVID-19, and 36% people said yes. We used an assessment to assess their mental health, and most of the responses that we got, like in assessing how they're currently feeling right now in terms of worthlessness, everything was an effort. They felt that they're so depressed and nothing could cheer them up, restless or fidgety, hopelessness, nervousness. Most of them feel these some of the time. So the green and the purple. Oh, sorry, I don't know if you can see that. Uh, And especially, I do want to highlight nervousness. Almost half of the people feel nervousness some of the time. And if we add some of the time, most of the time, and all of the time, that's more than 50% of the people indicated that they feel nervousness. So as you can see, it's pretty neutral. They feel these things some of the time, but it is a large amount of people that indicated that this is affecting their mental health. Coronavirus is affecting their mental health. And there are so many memes that got out during these times, and I just wanted to, in light of everything that's going on, these are some of the things that I found was really funny. um, the first one is 2020 is almost over. We're in the home stretch, and the home stretch looks like this, which is very true. Everyone in their online classes now. I'm sure you guys have seen some of these. And then living in California in 2020, during this time, we had the fires going on, there were lightnings, and we couldn't gather with some of our friends. Yes, and at some point, this is how it looked like, right? It wasn't only just the coronavirus and the civic unrest, but also environment. It was negatively affecting our mental health. There were so many things that happened this year that's affected us. And so I'm just gonna stop here. And I'd like for us to have more of a discussion. Since this is a smaller group, just let me know your thoughts. Like, what did you guys think about the responses that we got from the survey? Can anybody relate? Does anybody want to share some of their experience during this year?
I could start off. I feel like in addition to like with the overarching pandemic, I felt like my mental health also deteriorated because of a lot of, I guess, like political unrest as well, like with the Black Lives Matter movement gaining a lot of was it drive in the summer, and then trying to carry that into my daily life and being more aware of it, as well as like the presidential election on top of all of these obligations. I felt like I was spread thin, and there are times where I had to like unplug in order to like, I guess, like to refill my glass again and then give more of myself to these movements.
Thank you, Marnelli. Yeah, I think that was another event that happened in 2020. It was the, the election. There was a lot of anxiety around that. Thank you. Has anyone experienced, like discrimination for being Asian? No. Yeah, I think for me, and looking at the result of the survey, I haven't experienced that growing up, but just seeing how the responses and how other people are feeling, especially when someone said that they're afraid to go outside because of the color of their skin, that to me is alarming, and it hits home because there's a lot of people who, are discriminating us because our political class, or people are associating this pandemic to be a Chinese virus. So it's really alarming to see that people are afraid because of the color of their skin. So kind of looking at some of the chat box. Marnelli, thank you for saying that humor is your favorite coping mechanism. Does anybody have other coping mechanisms that they'd like to share to help us during these times? Okay. Peter said journaling. Jan said cooking and baking. Jara said watching favorite shows or reading. Okay, a lot of people are journaling. Okay, I might try that. Awesome. Has anybody started like gardening or baking a lot of banana breads? Hi, Meldick. It's nice to see your face. Mindfulness exercise. Hi. Buying new plants. Me too. If you guys would like to unmute yourself, that would be great as well. I know the chat is popping.
Ooh, to all of the plant moms, I need advice. I literally had like I killed two plants, guys. Like they died on me. Like and I was so sad. I was like, you know what? Maybe this is a sign I'm just not meant to be a plant mom. The only thing I managed to keep alive is like my snake plant because you don't really need to do anything to maintain it and whatnot. But literally, I can only like um keep snake plants alive. Anything besides that, they die.
I know it's also the winter time, so yeah, I think our plants are gonna start dying soon. I know. I just cut like a lot of yellow leaves yesterday, so it's sad. As far as advice, I don't know, Shane, do you have some advice on how to take care of our plants during these times? I know grow lights are a thing, right?
I think it's hard because plants obviously can't like talk and tell us like what they need or want, because some it's like you need more water or you're overwatering it, too much sunlight, not enough sunlight. So it's kind of like you just have to like test it and like experiment with it. Like, just don't be too hard on yourself if you kill some plants, because I know I have, like, along the way. So, just like, like maybe placing it in different areas. I know for me, if I want to water my plant, like I touch the soil, like I dip my finger in there to see if it's like moist or dry. So, yeah.
There you go. I love that I'm able to see some of you guys showing your face. Since Marnelli, we have a little bit more time, right? Okay. Would you mind if we go around and just kind of introduce ourselves? Like, I just don't want to leave here not knowing who you guys are. So I think I want to take this opportunity to introduce yourself, maybe share with us like what field you're in, and how has the pandemic impacted you, if you'd like to share. We'll start with Alyssa. Did I say that right?
Oh, we're starting with me. Hello. My name's actually Eliza, but it's fine, girl. Don't even worry. They call me Lai too. So, wait, what was the question again? Like what field we're in,
Mhm.
and then just getting to know about each other, right? Okay. So, um, Marnelli knows this, my girl from yesterday's breakout room. But I am a recent grad of UCLA. I was actually in the same class as Augustine in here, AJ. And I graduated with a major in Phi-Sci, which is physio, and a minor in Asian American Studies. Right now, I'm working in my gap year. I'm working at a place with a lot of puti people, at a dermatology office in Santa Monica. And I'm not gonna lie, y'all, that work it'd be really eating away at me. Especially because in undergrad, I worked a lot with, providing access to the Filipino community, whether that be for like education or working with the homeless community in terms of accessing healthcare. So I am starting to realize that that place is really not it for me. And I am really planning to, in the next couple months, really find a job that is more in line with my mission and vision as a person. So that is going to be in public health. I'm going to be manifesting that. Yes. I don't know if you say your name Eliza too, but yes, I felt that. What was the last question? I'm so sorry. Sorry, I'm like kind of nervous. How COVID has been for me. It's been a roller coaster, to say the least. I think, your question earlier about like what are coping mechanisms that we've come up with. I've recently been trying to tap into more like spiritual practice, right? I grew up Catholic, and it's some like woo-woo stuff, like watching like tarot readings and stuff like that. But at the end of the day, it's just really helped to kind of um, help me work through what I'm feeling, and like really tap in with the universe. So that's just my understanding, and I will mute myself because I'm rambling. Thank you so much. Bye, y'all.
Girl, yeah, drop that. LinkedIn if you're yeah, if you guys want to drop your LinkedIn, Instagram to connect, I think that's one coping that we can do is stay connected with each other. And yeah, like that way Alyssa can share some of our Elise. Oh my god, I'm so bad with names. That way she can share her woo stuff with us. Um, I'll go to the other Alyssa. Is that how you say it? Eliza.
Eliza, yes.
Yay.
It's so no worries. It's so cool to meet another Eliza. Hi everyone. I'm Eliza Garcia. I graduated from St. Mary's College in the Bay Area about 2 years ago in education and ethnic studies. So my field is in education. I'm teaching after school program, giving them college access. And y'all, it's been a trip 2020 with Corona, the elections. It's definitely been eating away, but it's also been a little bit of a blessing to really take time to be at home and kind of refocus on mental health and with family. So thank you.
And then we'll go to Jaira.
Hi everybody, my name is Shara. I am a public health and Philippine language and culture Ilocano student at the University of Hawaii at Manoa. I'm currently in my last year, so I'm pretty much just finishing up my capstone project and things like that. I'm low-key really excited to graduate. This past years with coronavirus, it really tested my skills that I thought that I was really good at, such as time management and really being independent in regards to my learning. Um, Coronavirus, this pandemic really showcased that I really need to work on prioritizing. I never realized how much, like with COVID-19, I feel like a lot of my professors did give a lot more work just because we were at home and whatnot. I understand, yes, we are at home and things like that, but you have to consider that you're at home in an environment that you're whoever you're living with is not from it's not they're not familiar with you doing work. I don't think like a lot of my professors realize that yes, I do have more time to do work for you guys, but I'm at home. I have family obligations to do too, you know. Although despite that, there has been positives with COVID-19. Like I have never developed such a close, like my family has always been close, but this pandemic really got us supporting each other, relying on one another, and it really put my public health skills on like really tested my public health skills. Like my parents are Filipinos, and they speak primary, like they speak Ilocano. So this pandemic really got me really showcasing my Ilocano skills to them as we talk about like, oh mom, dad, remember, don't be doing this. Please wash your hands all the time. And I tell them like, they would ask me like 20 seconds. I'm not sitting there counting to 20 seconds. And I'm like, okay, do ABCs because that's what you tell kids, right? So I was like, mom, dad, you guys can sing the ABCs. It's all good. And yeah.
Thank you. Yes, I'm a Ilocano too, so it's nice to be able to connect with people. Yay. Maldrick.
Oh, shoes. Okay. Let me pull up the questions. Okay, so I'm Eldrick. You can call me Mel. I I'm studying at the University of Hawaii at Manoa, and I'm a fourth year undergraduate. Going to do my master's in the next year. And the coronavirus has impacted me in a lot of ways. I think physically, I don't really go out much. I feel like I'm agoraphobic. I don't go out a lot, so that's that. Mentally, I feel so drained and I'm so sick of school. Like, quite honestly, I'm just like, it's like deadline after deadline, and I feel like I'm living like, I don't know. I just feel like I'm not like doing anything with my life. But yeah, and socially, it's been hard because my friends, like, we all live close with each other, but we don't really link up as often because we can't really. We have a lot of like mandates in Hawaii. What else? Emotionally, I think I've gotten a lot better. I got through a breakup. Still like going through things. Um, but a lot of good came out of it. I've gained a lot of new skills. I learned how to sew. I know how to tailor clothes. So let me know. I also just have been reading a lot. So yeah.
Thank you, Maldrick. Well, that's a lot. We're here though. We're connecting now. Chris.
Hey y'all, I'm Chris. I'm from New York. I am a MPH candidate in social and behavioral sciences at New York University. As far as how the pandemic has affected my life, similar to what was presented as far as the racism and exacerbation of mental illness, I'm somebody who's afflicted with bipolar 1 disorder. So it's definitely put a strain on how my symptoms react, but I am definitely thankful for being part of a health insurance pool. And I defer to exercise as a way to get through the stresses of being a grad student and also being a librarian. I'm a student consultant at the research technology department at my school's library. So I defer to gymnastics and running and martial arts quite often to, I guess, release these pandemic anxieties.
That's awesome. Thank you for sharing.
Of course. And if you have any questions in regards to my perception of mental illness, I'm more than happy to share my experience.
Is that I don't want to put you on a spot, but is that something that you'd like to share with us today?
I'm sorry, is that something that I'd like to
share with us with this group?
Yeah, sure. If you have questions, yeah, I'm more than happy to answer them.
Okay. So if you guys have any questions for Chris.
I mean, regarding depressive episodes, manic episodes, how to deal with. Usually my symptoms become episodic at the beginning of semesters, and it's not until I settle into the semester that I'm able to sort of get a hold of things. So in line with destigmatizing mental illness, especially in our Filipino American community, I am willing to share my experiences.
Okay. We'll go through we'll go through everybody's list, and then we'll share space on that area. Peter.
Hi, I'm Peter. I am currently a fourth year undergrad at Stanford studying social dynamics of data and information and ethnic studies. Actually, because of the pandemic, I recently applied to a co-terminal master's program and just found out this week that I got in on community health and prevention research. And so I think, yeah, like the pandemic honestly really pushed me. Like I was pre-med when I first started as an undergrad. I think it's like a family, like, oh, you should do this. And I kind of drifted away. But then I think kind of seeing the public health crisis, and also after doing like a lot of community organizing, I recognized that, like, you know, getting more involved in health was something that I wanted to do. And so I think that's like one of the big things that this pandemic has done. I think coping mechanisms, yeah, journaling has been a big thing. I started doing therapy too during the pandemic, and also dance has been a big outlet for me. But yeah, I mean, just like on the therapy point, like I highly recommend, and like there are a lot of resources that folks can access in like different spaces to get like affordable therapy. And like if folks ever want to talk about that, like I'm like always open to that. I serve as a peer health educator at our campus, and so like I love to talk about like just like mental health, sexual health, physical health and stuff. And so yeah, like thank you for hosting this space, you know, and having this workshop, and thanks to like the staff and folks for putting this on.
Yeah. Thank you, Peter. I agree. Oh my gosh, that's awesome. Let's do Antonella.
Hi, hello. I'm calling in from New Jersey. I actually went to school in Boston, and I lived in Boston for 5 years, and then I moved back home for the pandemic. So that's why it's a little bit darker in my room. But yeah, I work currently as a project coordinator at at the Institute for Healthcare Improvement that's located in Boston. And I'm really interested in like public health and the intersections of mental health, behavioral health, as well as in urban design. And so when it comes to thinking about my mental health, I feel like I have spent a lot of time thinking about it before the pandemic, but I think in the pandemic, it kind of accelerated all the things that I was thinking about in terms of like what I want to work on, what kind of goals do I want to make to help improve my mental health. I know when I first started working, one of the first things I did was to look for a therapist. And when I actually started therapy, I realized it's not just about like looking for the right or not just looking for a therapist, but looking for the right therapist. So I felt like I didn't feel as open talking to her about like my cultural background, which was really important to like my treatment. So it made me think more about like what therapy for people from multicultural backgrounds, what that would look like. So that's something that I've been taking some more time to think about, especially now. I don't do any therapy right now, but I've taken to doing like meditation and just general like exercise to like keep myself in check, even though it's like doesn't always pan out. There are definitely a lot of days that I just don't feel like doing anything. But I'm also the type of person who like encourages people to just feel what they're feeling and check in with how they're feeling instead of like not addressing it because it eventually will come up later. So yeah, I'm here in Jersey. I hope to do my MPH at one point. So if anyone wants to connect on the East Coast, I'm here. I'm low key trying to go to the West Coast though, eventually for a grad program, but we'll see.
Thank you, Antonella. And thank you, Chris, for providing that connection with us. And just to kind of make that connection, do you have some maybe like tips on how to, not just Antonella, but for all of us, on how to seek mental health services or finding the right one? For Chris.
For me, oh, okay. I would say definitely check with your health insurance plan. The first thing I did, because I'm with providers who I've been with for about a decade now, was I made sure to connect with them and to make sure that they're able to cover my services, depending on like, because they've transferred locations several times and they've worked as a team as far as psychiatry and therapy is concerned, and they've worked in their own private practices. So make sure you connect with your providers and make sure it connects with your health insurance. If you're enrolled in school, definitely utilize student health services because although student health plans, from my experience and from what I've gauged from like NYU or UCLA, for example, is that they have connections for temporary or crisis situations, but they don't have the long-term services that you may require. But they do have the human resources to do the research for you in terms of connecting you to care that's affordable and appropriate for you. So I would definitely say, like I've done my research with my student health center as far as connecting to long-term therapists. Definitely reach out to your student health center if you're enrolled. Now, if you're not, and I just had an experience this past week enrolling in Medicaid because I turned 26 this year. Become familiar with that process if you're approaching that age and you no longer apply for, or rather, you're no longer eligible for your parents' health insurance. I had experience with speaking with a woman over the phone who enrolled me right away, and I'm just waiting for my card to come in the mail, and it was pretty seamless. It took about 20 minutes to go through that process. So as far as connecting yourself to mental health resources, definitely use the institutions that you're already a part of as far as they can go, because remember that the social workers are paid to provide that service for you as a student in those institutions. I would also say that a good service for if you're not so familiar with the mental health system is NAMI, the National Alliance for Mental Illness. I have experience with attending those meetings, and it's joining with people who are going through the same experience, and these are people who have been through inpatient, partial, et cetera, et cetera. So definitely I mean, I know that it's with the virus that those meetings typically take place in person, are not taking place. But if you don't feel like you have resources, like check NAMI's website. I'm gonna see if I can drop a link in the chat box as well, because they at your local what is this called, Bipolar Depression Alliance meetings, they could be having Zoom meetings they could be having remote meetings over Zoom. Personally, I just haven't utilized that service because I feel like the services that I have are sufficient, but definitely see what they're doing nowadays with regards to the virus.
Thank you so much, Chris. Yes,
No
let's,
problem.
destigmatize this. And I think, we need to, there's a lot of resources available and we need to be able to, utilize those because we're allocating money for those. So yes, thank you. So we do have a couple minutes left. Marianne, would you like to introduce yourself to us?
Hi. Sure. Hi, everyone. So I'm Marian, or call me Mar, and I'm friends with Chris. He let me into this um, conference, and thank you so much for the organizer for organizing this one, because it's really a great community to be able to see Filipino Americans in public health. So I'm a first year student in the MSPH International Health Systems program at Hopkins, and I graduated from UCLA last 2018. Did some work at asso- coordinator for a dean at University of Southern California. So I've been actually was living in Los Angeles ever since I've arrived from the Philippines, but moved here to Baltimore. So as for how am I during this pandemic, it's been tough because I've been trying to I guess adjusting into grad school, and grad school work isn't is not the easiest one, but also at the context of COVID-19 as well, where everything is online. So it's been really rough. And what I've been trying to do to cope up with this is also exercising, cooking a lot of Filipino food, surprisingly, because I've kind of got that part from my dad because he cooks a lot. So I do lumpia for everyone, and also running as well, and actually martial arts too. So I've been training Muay Thai, but of course with masks and all that, and also just trying to be careful as well. So yes, nice to meet you, everyone.
Thanks, Marianne. Wow, we have such a great group of people here. And it's so nice to be able to see everybody. Okay, let's go on to Natalie. Is she there?
Hi, I'm Natalie. I'm currently living in New York. I graduated in 2019 from the University of Delaware with a BS in nutrition and medical sciences. And then post grad, I was trying to figure out what I wanted to do with my degree. So I worked as a nurse technician for about 6 months. But then the pandemic hit, and that's kind of how COVID started affecting me. I actually quit my job as a nurse tech because there were no real protocols in the hospital yet for employees at higher risk. And since I had a history with cancer when I was little, I just didn't really feel safe working in the hospital, so I had to leave. But now I'm currently working as a Title I teacher. So if you don't know what that is, it's basically like extra, what's it called? Like extra assistance for kids in lower income areas. So the program, it's basically government funded extra help with school for kids who qualify for it. And I work with kids in the Bronx, basically like after school help. And I'm just doing that while working on my MPH application. And I guess mentally, the pandemic has definitely pushed me to seek therapy for because I think I've always struggled with pretty bad anxiety to to a certain extent, but I never really did anything about it, or I kind of just pushed it off and said, "Oh, it's not that bad." Um, the as we were saying, the Filipino stigmatization, I guess Asian in general stigmatization for mental health care. My parents were always like, "Oh, what do you need to go to therapy for? Um, what do you have to be depressed about? What do you have to be, anxious about?" Which I heard a lot, and I kind of just took that and said, "I guess nothing." And then I never really, seeked help from there. But I think the pandemic definitely pushed my mental health to the point where I don't think I could, use yoga or meditation or journaling alone to help me. Um, so I finally reached out to my doctor, and I'm going soon for my yearly appointment, and they're gonna help me get set up for therapy after that. But yeah, I guess that's me.
Natalie, so I know we didn't get to everybody, and I'm actually really sad about that. Our time is up, but I just want to say thank you to everyone that's on this webinar today, and I will hand it over to Marnelli.
All right, everyone, thank you all for attending the 2 workshops. If you go back to your Google Calendar, start heading back to the main room, we'll have some closing remarks. Thank you.
Thank you.